Doctors advise pregnant women to take folic acid to help prevent certain birth defects, but a new study suggests it's possible to get too much of a good thing. The findings show an apparent link between high levels of the vitamin in expectant mothers and a greater risk of their children developing autism. Joining us now is our AM medical expert, Dr. Marla Shapiro, and this caught a lot of eyebrows going, huh? Because folic is what everybody is told to take when they're pregnant.
So we do know that folic acid is very important to reduce the risk of something called spina bifida. And in fact, there have been previous studies that have showed that low levels of these vitamins can lead to autism as well. So this study is looking at excessive levels of folate and B12. So let's first look how the study was done. 1,300 mums or so, close to 1,400 mums, followed over a period of time and what happens to their offspring. And they did a single level of folic acid and B12 within the first 3 days of birth.
A single level?
A single level. So that's the first thing that what you see at birth, does that really reflect what was happening in the first and second trimester, where we're so concerned about adequate levels of folic acid in terms of neurodevelopment and possibly not enough linking to autism spectrum disorder. So we don't know what happened. It was just a single level, and that's very important to recognize. In addition, of the 1,400 mums or so that were studied, 100 turned out to have this diagnosis, much more than the background noise in the general population, where we would expect 1 in 68. Very small numbers. We found that some of the mothers in this study had excessive levels of folic acid and B12. So we're talking about 600 picograms when the expected level is somewhere below 49 or so. So we're talking really high levels. And what it saw was when you had very high folic and very high B12, there was a 17-fold increased risk of autism. But the caveat here is how the study has been done and the very small numbers.
And how much is too much?
So that's the question. We've had this discussion with calcium as well, and it's important, I think, in a general way to recognize that many vitamins and minerals are threshold. What you need is what you need, but too little or too much may have deleterious effects. Now, is too much in the case of folic acid and B12? Early days, it's an interesting question to ask. Is it because these mums took too much? Is there something in their genetic predisposition that may have led to absorbing too much? We're not really sure. But the caveat to mums here is that understand that the adequate amounts that we recommend in the typical prenatal vitamin supplement, and the reason that we fortify our food with folic acid, is because of the link to the importance of adequate exposures in the first and second trimester.
Is it important to still take a prenatal as well as have, say, vegetables like kale and leafy greens that have folic? Are you doing both?
You know, we always talk about the fact that getting things from your diet is the best way to get the vitamins and the minerals that you need. And certainly I think in the levels that we recommend for moms to take during pregnancy and prenatal vitamins, those are the levels that we've always been using, the doses that we've always been using. But we will always see some moms who dose in excess or take more, thinking that more is a good thing. So I think it merits a conversation with your physician one-on-one. What is your diet like? What is your adequate exposure like? We are certainly still saying the guidelines are not changing. This is an interesting study, an interesting question, but let's be reasonable in how we interpret it and recognize that this is an early association in early days. It may pan out to be true, but have that one-on-one conversation. What are your needs during pregnancy?
You're the voice of reason. And this is why we had you here. Quickly, you're going to Ottawa. Tell us why.
Tomorrow's the investiture for the Order of Canada, so my family and I will be in Rideau Hall, and we're very excited.
We are so proud of you.
Thank you.
Love you, Marl. Congratulations.
Thank you.